Dr. Rebecca Baxt. I'm going to be injecting filler into Kim's lips. Kim has beautiful lips. She wants them a little bit bigger. She likes when she smiles that she doesn't want a gummy smile. She wants her lips to show a little bit more over her teeth. She's had filler in her lips before. It's been about a year.
Yeah.
And they still look good, but she'd like them just a little bit bigger. So we're going to put in 1 syringe of Juvederm Ultra, which is very smooth and nice and FDA approved for the lips. And we're going to do a little on the upper, a little on the lower. And she doesn't have any numbing cream in, so we'll see. It does hurt a little bit, but I think will tolerate it fine. She's had it before. You ready?
Yep.
Yes? Okay, here we go. So I usually ask people, do you have any history of fever, blisters, or cold sores?
No.
No, because if you do have a history of fever, blisters, or cold sores, we would want to pre-treat to prevent that. Besides for that, have you been taking any blood thinners? Aspirin, Aleve, Motrin,
No.
vitamin E, fish oil?
Maybe an Excedrin, but
An Excedrin, but not in the last week or so?
No.
Probably not. Okay, so that just increases the risk of bruising a little bit, but you could still do the treatment. If people get bruising on the lips, especially women, it's easy to just wear dark lipstick and it covers it and it heals pretty quickly, but it can happen. So here we go. Hang in there. So we're injecting Juvederm. This is hyaluronic acid. It's a clear gel. It's a substance that occurs naturally in our bodies. And this particular substance is made by bacteria. The bacterial proteins are washed out, and it's just a clear gel. And it's natural, so people don't get allergic to it. But it can cause some swelling. It's hydrophilic. It absorbs water inside the body. So I usually tell people it does not necessarily look its best today, but it looks its best almost a month or so later, and also over time, because it helps grow new collagen and it absorbs water inside the body. So if you stay well hydrated, it tends to plump up. If you get dehydrated, it's going to shrink down. If you're well hydrated, it's going to plump up. So sometimes it can look a little bit different from day to day, just like your regular body would. It's a natural substance. So when we put it in small boluses, and I'm going to massage it at the end. So I always warn patients not to worry if it feels a little bit bumpy with your tongue. Sometimes you can feel it, it's a little bit bumpy, but we massage it and that smooths it out. And the nice thing about this particular product is that, I'm going to switch sides, so just watch out. If it does get bumpy, the bumps are reversible, so you can inject an enzyme and dissolve. So can we see one side to the other side a little bit? Yeah, you can see that one side, the right side, is a little bit bigger right now than the left. It looks pretty. I'm just enhancing her natural lips. I'm not changing the shape of them. I'm just making them a little bit bigger. So here we go on the other side. That looks beautiful, I think. Maybe a little bit more right here. Do a little on the bottom. Well, that just looks gorgeous. It probably feels a little bit bumpy. I'm going to massage it. I don't even know what to say. It looks so good. But she's easy. She has beautiful lips anyway. I'm going to save just a little bit in case there's any area I need to touch up, but let me massage it and we'll take a look. Open your mouth for a sec. So I don't recommend that people do this at home unless they feel a bump, because this can cause some swelling, but I like to make sure there are no bumps before someone leaves the office. So I'll just massage it a little bit. If you feel a bump at home, you can do this gently a couple times a day to see if you can get rid of it. If the bump does not resolve, we can remove it with an enzyme injection. So It's very rare that we need to do that, but once in a while we do. Kim, how you doing?
Good.
How does it feel? Run your tongue inside. Is anything bumpy? Or it's pretty smooth? Okay, let's take a look.
That looks so good.
Smile. So you can see, I mean, she's a little bit swollen, but you can see that achieved what she wanted. She wanted her lip a little bit bigger on the top, so when she smiles, you don't see any gum. She's a little bit swollen. Smile again. I might just put a little bit more right there at that edge to make sure it's nice and even, and then we'll be done. Smile again. Relax. Smile. Well, that fixed. Smile. So I don't want to block the camera, but I like to look from the front. That looks great. I don't know if that showed up on the camera, but you can relax. She had a little spot that basically needed a little bit more over here. And now we're perfect. I'm just going to massage that. And then she's finished. Open your mouth one more time. And she's good. Thanks for watching.